If you suffer from urine burning, urinary tract infection, discomfort or painful urination, then Ural will help you great deal. In today's video, we will discuss conditions under which Ural is used, how to use, its dose, conditions in which it should not be used, and its possible side effects. Ural contains sodium bicarbonate, anhydrous citric acid, anhydrous sodium citrate, tartaric acid, which is used to treat below-mentioned condition including urine alkanization, that is, it reduces the acidity of urine, thus inhibits the growth of bacteria, reduces urine burning, and also reduces difficulty or discomfort in urine. Treatment of urinary bladder calculi, which are also referred as bladder stones. Cystitis, which is inflammation of the bladder, usually caused by a bladder infection. Kidney problems. For heartburn or stomach acidity, where it works by neutralizing stomach acid. Let's see how to use this sachet. Always take this medicine exactly as your doctor or pharmacist told you. Open the sachet, mix with cool water in a glass and drink. The recommended dose is 1 to 2 sachets, 4 times daily. Take this medicine after meals. Use Ural for 5 days. Do not take for more than 5 days, unless advised to do so by a doctor. If you forget to take a dose, take it as soon as you remember it, unless it is nearly time for your next dose. Do not take a double dose to make up for the forgotten dose. Do not use Ural if you have high blood pressure, as it contains sodium. Ural should be used cautiously in patients with cardiac failure and impaired renal function. Some of the side effects which you may experience are headache, upset stomach, muscle pain. Help us grow by joining and subscribing the channel. And if you have any question, drop below, we will answer that.